Hi, I'm Dr. Mark and I am happy to share with you the exciting improvements my patients are experiencing in the relief of their knee pain and stiffness. These improvements come from a combination of natural therapies that I have put together and continue to evolve and expand as the improvements do. And in many cases, these patients were told that their degeneration was so advanced, the only option for them was surgery, and they were not ready to go under the knife. But they are now very delighted and happy with the improved quality of life that they are enjoying from the relief that these natural therapies have provided them. Or if you're experiencing any discomfort of the knees or other joints, you owe it to yourself to give this a listen and consider natural therapies as an option to improve your joint discomfort and quality of life. I'll share more with you later after the presentations. Mary, I want to thank you for coming in and joining us today, and I appreciate you sharing the story of improvement you've experienced with your knees and health overall.
Well, thank you. I certainly have enjoyed an amazing quality of life improvement since I've been using the cold. You have been using the cold laser to help me.
Yes.
In 2006, I was diagnosed with knees that were in bad shape and would, on the outside, need a replacement in 5 years. Well, many more than 5 years have gone by, and I am not even remotely close to a replacement. And pain-wise, it's nothing like what it was when you first started the treatments. I have virtually no pain unless I make an unusual move, and in that case, I would probably have pain with a perfectly healthy knee. You know, stepping into a hole when you're not watching, when I walk the dog, that kind of thing. So it's been, well, I call it a miracle. And I have told my friends about this that have problems, and I told them that I think that Dr. Mark is a miracle worker and that the cold laser has just made a huge difference in my quality of life. And I appreciate it so very much.
Well, you're very welcome, and I'm so happy that you're feeling strong and pain-free and able to stay as active as you are, going to the gym several times a week, gardening, recent trips to New Zealand where you're hiking all over the place. And you know, you're really enjoying your retirement.
I am.
The key to that is to keep moving, and the key to keep moving is to stay pain-free.
Exactly true. Thank you.
You're welcome. Today we have Greg joining us to share his experience. He was one of my first patients that has had remarkable results in the treatment of his knees. I thank you for joining us today, Greg, and tell us your experience, your story.
Well, I'm happy to be here, Dr. Mark. About 6 years ago, I injured my right knee for the third time. And previously, each time I would injure my knee, I'd go see an orthopedic surgeon. And they would schedule me and they would repair it, and I'd be back to normal after 6 weeks or so. However, this time, I was in excruciating pain. I went and saw the doctor, and he gave me some heavy pain medication and basically told me that there was nothing more they could do to repair the knee, that I was now a candidate for a total knee replacement. So when they told me that, they told me then what I could do, and squash was not going to be one of the things I could do after I had my knee replaced.
And you love squash.
And I do love squash. So I couldn't make a decision right then. I had 2 weeks. I went back after 2 weeks, and I just basically told the doctor that I'm not ready yet to make that decision, to make that kind of a lifestyle change. Right after that, my wife Sharon suggested that I come see you and see if there's an alternative treatment for my knee that would not have surgery involved in it. So I did. I came and saw you, and very pleased that I did, because you were able to develop a treatment program for me that used a low-level cold laser on my knee with other types of treatment, And in about 2 weeks, I noticed that the pain in my knee was diminishing. And I wasn't sleeping. I had so much pain in my knee, if my leg moved in bed during this early time, I mean, I just wake straight up with a shooting pain.
Wow.
So after about 2 weeks, I noticed that I was sleeping a little bit better, and I was able to start reducing my pain medication.
That's great.
And after about a month, I noticed that I didn't need my pain medication anymore. I was starting to walk normally and feeling much better about myself.
Mm-hmm.
And so we reduced down to twice a week at that point in time. And I continued trying to build my endurance and my strength simply through small things. I wasn't trying to exercise yet. I was blessed with that relief of pain and thinking that we could get back to things. And that's when you and I discussed whether or not I could start becoming more active, and you said, well, you know, we need to try it sometime.
Right.
So I started exercising a little bit and took the time to go play squash by myself in the court, just moving around, hitting the ball to see how my knee reacted to it at that point in time. Okay, I wasn't mentally blocked from making moves, change of direction, stopping, lunging forward, all those things, which I couldn't do. I couldn't even have thought about doing that when I came to see you.
That's terrific.
I'm back to full playing squash and enjoying my life, and don't have to worry about going through airports and setting off the metal detector machine.
That's great. Including you're playing international men's senior competitive on the U.S. team.
Absolutely, I'm loving it.
That's great. Well, I'm glad to hear that, and it does my heart good to know you're back enjoying life and what you have passion for. Thank you, Greg. Gus, I appreciate your joining me today to share your experience on how we've been able to help you have less pain and greater mobility in your knees.
My pleasure, Dr. Mark. Thank you for having me here today.
Tell me about what your experience was here.
Sure. Well, I basically have been coming here as a patient for about 10 or 11 years for chiropractic care. Roughly 4 years ago, I was diagnosed both in the left knee, first in the left, then in the right, with a torn meniscus in each knee. I've undergone physical therapy, but what I found is that with regular chiropractic care, and more recently with the usage of your cold laser,
Right.
On regular treatments, I haven't had to undergo any type of surgery to clean the knee out. I have full mobility. I can walk pretty well. And when I have the treatments, or when I receive the treatments rather, if I go a little time period where I don't receive the treatments, then I start limping again, and I have trouble walking, and I lose some mobility. So I found that the cold laser in conjunction with the chiropractic treatments have been very beneficial for me. And as a result, I haven't had to undergo any type of surgery since my first diagnosis.
That's terrific. And you had the meniscus and the advanced arthritis.
Correct.
And they were saying surgery was really your only option at that point.
Yeah, basically what they want to do was go in, clean everything out, and then do rehab.
See how that goes. But unfortunately, cleaning out means taking away what cartilage is left.
Correct.
Which is a losing battle, because then you have less and less cartilage to work with, and as that worsens, that eventually leads towards a joint replacement.
Correct, and that's what I was trying to avoid. And so I did find the cold laser to be very beneficial.
Great.
Far more so than if it were just regular chiropractic care.
And you're retired now and trying to enjoy an active and vibrant retirement and second half to life, and I'm glad you're feeling better.
Exactly.
Get you more active again and enjoy your life.
Exactly, and that's why I've been undergoing the treatments, and I recommend them to anybody that hasn't tried them. It's certainly far better than undergoing surgery.
Well, at least surgery is always an option, but it should be the last option.
Correct.
Very good. Thank you, Gus. I
You're
appreciate
welcome,
you coming
Dr.
by and sharing your story.
My pleasure. Thank you very much.
You're very welcome. Gary, thank you for joining me today, and I appreciate your sharing your story of the experience of improvement you've had with your knees.
Thank you. Thank you. Yeah, when I was younger, I was very active. I used to run 7 miles every other day, swim actually a mile every day in my 20s. And of course, as I got older, got busier, the activity decreased, but even into my late 40s, I was running a couple miles every other day.
Mm-hmm.
And then my knees started bothering me, and when I ran, they swelled up, and I had to stop running. And I even tried better shoes, having wraps around my knees and getting back to running, but each time I did that, my legs just really hurt and swelled up, so I just stopped running. And after that, and also getting older, I started to gain weight. And as I gained weight, I had some back pain, which was diagnosed as sciatica, and then also I developed obstructive sleep apnea. And one of the things that I really like to do is go with friends hiking, and we would go to Glacier Lodge in the Sierras and hike up from 8,000 feet to 10,000 feet and go to see all the 9 lakes around there. And before I started coming here, I went with a group of people and I couldn't even go halfway. So I had to turn back, and I really like to hike, so this was disappointing. It was a little embarrassing. I went back to the cabin, and then luckily a friend recommended you, and I started coming here, and you showed me to get, first of all, to get better shoes, to get new shoes, to have orthotics put in, which really helped. Other tips, and then started therapy. And since I've started therapy, I'm able to walk a lot farther. I do not have daily pain, so it's actually rare that I actually have pain. And currently I walk at least 15,000 steps a day. That's 4 days a week, over 20,000 steps. And the last time I went up to Glacier Lodge with my friends, I was able to actually go up all the way up to Second Lake with no problems, and all the way back, and had no pain. So thank you very much.
You're very welcome, Gary. It's exciting to hear you enjoy the things that you have passion for, and your health is improving, and your quality of life is getting so much better again now.
Thanks.
I sure appreciate my patients sharing their experiences with you, and it's so gratifying to see them enjoying life again at a more active level, because activity is the key to staying young and enjoying life. Once, because of joint pain or other restrictions, we start slowing down and being less able to move and get around, that's when aging starts accelerating. The research is clear. To keep your brain young and healthy, exercise is the most proven beneficial thing you can do. And for overall health, heart disease, diabetes, and every other condition, staying active, keeping moving is the key to health. And the #1 disability that people experience as they age is arthritis. It's the most common disability experienced by middle and older age individuals. And the treatments up to now are often limited to painkillers and anti-inflammatories, which have their side effects, and when steroids, which have potential side effects, and when the condition cannot be managed any longer with these medications, surgery. There is a place for surgery where every other option has been tried. Surgery is better than not moving and suffering pain or taking too many drugs that can build to toxic side effects. But natural therapies, as you have heard from my patients, can be remarkably powerful and effective as well. I've been a doctor of chiropractic for over 30 years now. I've practiced in the prestigious Bologna Institute and done research in Italy. I practiced in Paris, France, and I've been in practice in lovely Southern California for over 26 years, mostly in Long Beach and now nearby in Westminster, California. I am also a certified traditional naturopath, where our training is to provide natural, holistic solutions for most any health need or concern that may arise. And in all my years of practice, I've never seen the results that my patients are experiencing by combining these natural therapies. And I encourage you to give your body a chance. The theory has been that arthritis, osteoarthritis particularly, is the wearing down of cartilage in a joint like the wearing down of a pencil eraser with use. And once it's worn down, it never comes back, and when it's gone, it's gone. But these patients have been told they have bone-on-bone arthritis by their doctors, even though in some cases they say both knees are bone-on-bone, but only one knee really hurts. So how does that explain the pain? But regardless, with these natural therapies we're supporting them with, their joints are seeming to rejuvenate, because where they had pain that they couldn't walk without support and even sleep without suffering the pain, they are now experiencing greater and greater activity and strength and mobility without pain. So that seems to reflect their joints are rejuvenating and growing healthier, and that is irrefutable. And I encourage you to give your body and your joints a chance to heal and rejuvenate with natural treatments and care. And if I can help you, I would love to. And if you're not in my area, try to find a doctor that is doing some of these therapies, and or you're welcome to try to contact me, and I can do what I can to help you. Thank you for listening, and enjoy an active life.